Hi, my name is Ryan Hoyme, aka Massage Nerd. Today I'll be demonstrating compression stretch techniques. With compression stretch techniques, it can be used with the clothes on or with the clothes off, but for some of the stretches it's better to have the clothes on just to be safe. So with this, it's kind of like Thai massage, it's kind of like shiatsu massage, and it's kind of like sports massage. So you might see some similarities with all this, so let's get started with the video then. Let me just do a little example of compression stretch. So what we're going to do with this is we're going to compress an area. So let's say the tibialis anterior, compress and then stretch. Compress and then stretch. Compress and then stretch. Compress and then stretch. So you can just kind of walk the body with that kind of technique. And with all these, if you know stretching, you can incorporate this. And if you know trigger point therapy, it'll be even better. So you can incorporate both into one then. So you're basically getting two things with one technique then. We're going to compress, make sure it's not on the tibia bone, compress, and plantar flex. Compress, plantar flex. Compress, plantar flex. Okay, so just keep going back and forth. And some people will just stay in one area and compress. The client is less likely to feel any kind of extreme pain with this too. So the faster you are, the more beneficial it will be for them. Okay, next one, I'm going to like snake bite. So I'm going to pull this way and push this way at the same time. Compress, push. And again, you can stay in one area or you can kind of move it around then too. And for people that are bigger, like for sports massage, it's going to be a lot more beneficial. Okay, next one, I'm going to flex up here, and we're going to use a little bit with the leg area. And what I'm going to do is, I'm just going to kind of stretch and push right on the IT band, and right on the vastus lateralis. So you're kind of rocking the body, and pushing at the same time then. But with average trigger point therapy, if you're just going to press and hold an area, it's going to be tender for them. But with this, the body doesn't have time to react as much. Okay, next one, I'm going to bring it out here. So kind of stretch and kind of push, like a pumping action. Okay, next technique, you can even put this right on your anterior deltoid right here. Push and kind of rock right in the hamstrings. And you can use your knuckles if you want in this area, as you can see. But using your shoulder, it's like an extra hand. You can even rotate it out like this. Another option for the same technique, we're going to rotate it out and put it right on our hip, right on our anterior superior iliac spine. Okay, rotate it out and kind of rock and kind of push. If you want right in the adductors, you can compress with your hand. And another option, you can kind of push down and push up. Push down and push up. Or even more, if they're not getting a good enough stretch, I'm going to rotate my hip like this. So I'm going to stretch out the gastrocnemius, the soleus region. Okay, next one, we're going to bring it up, compress, and stretch. So I'm going to, again, compress, like squeeze, and bring it up. Compress, bring it up. Compress, bring it up. Compress, bring it up. But if you stayed in one area, so when again, when I bring it up here, I'm going to compress. And when I bring it back, you can let off with the pressure a little bit. Then bring it up and compress it a little bit more. And keep rocking it. Okay, next option, we're going to cup the calcaneus, compress and squeeze. Compress. And you can have this same technique. You can kind of bend it, push and bend. Right into the hamstrings. And if you want a little bit more pressure, you can extend the leg while you compress. And it's a good idea to check in with the client every now and then for the pressure wise. Some of these techniques can be used on the floor, but it's a little bit easier for most of them on the table. Okay, I'm going to demonstrate on the opposite side here. So I'm going to go like this. Put their foot on your hip, rocking, pushing at the same time again. And you might hear a little pop in their back. That's okay. You can even kind of bring it down a little bit too. But again, if you want more pressure, it's going to rotate my hip more, so it's going to stretch out the gastrocnemius and soleus region. And another option is you can compress the adductors while you're performing this technique. And you don't have to use your hands all the time. You can use your forearm, your elbow, but try to use more of your forearm to start off with, and if they want more pressure, then you can use more of your elbow then. And if you want more of a stretch, you're just going to bring it out like this, have it straight. So you're just using your upper hip. And if you want, you can kind of push it down and compress. Just make sure your wrist is relaxed. And when you're performing these, be careful right here of the greater trochanter. Make sure you're not putting a lot of pressure right there, because bony areas, you're more likely to bruise them then. And you can kind of rotate it down too. Okay, next one, I'm going to kind of push and rotate the leg in. So immediately rotate and compress. And be aware of the tibia bone right here. So make sure you don't put a lot of pressure right there. And you can kind of work your way up the whole side of the body. But for demonstrational purposes, you usually want to even out the other side, but you can get the idea by this one side here then. Okay, next one, we're just going to kind of loosen up the hip. Just move it back and forth a little bit. And if you want, you can perform the compression stretch. Just pushing on there, of course. And again, you can use your forearm or elbow in this area too. Okay, another option, you can just bring the leg off the table a little bit. And you can block the leg with your shin. So I'm just holding it down and just rotating it out then, or you can rotate it in too, so either option of the quad area. And the quad area tends to be more ticklish on people, so that's why the little bit faster action of more of the full palm, less likely to be ticklish. And you can perform both at the same time, rotating it out, or you can kind of rotate it in too. Okay, next one, we're going to rotate this over, make sure it's above the patella here. You're just going to kind of rock the body, and you can even use your forearm a little bit, but just make sure this is always below the patella then at all times. And your elbow here, right here, you can add a little pressure right in the adductors. Another option, you can bring it here, compress, push. Or both legs at the same time, and if you need to, you can put your knee on it right here. Or you can just work one side at a time. So let's say you can't lift up both legs, just one side at a time is fine. But otherwise, if you can, both legs. And you can even kind of hug it and kind of compress the quad region too. Next one, you can place your knee up on here, and then you can kind of compress, kind of rock. Or another option, you can place the leg underneath here. You can kind of push down because you're stretching it, or you can ask permission to cup the hip. Just kind of rock on the adductors here, the inner thigh. Or if they can't handle that much of a stretch, just bring it out like this, and then cup, and just push. Another way, you can have both, like this. You can perform both at the same time if you need to. Depends on your time constraint. Or you can ask permission to get on the table and then compress it like that too. So again, just always ask permission for those kind of positions. Or you can kind of rock one side, rock the next. Rock. So just opposite then. Another one, you'll put your arm in here, compress. So this is getting the hamstrings and the gastrocnemius region at the same time. Or you can kind of rotate it over. When I'm rotating it over, my right elbow here is kind of compressing the biceps femoris and also the TFL region. Okay, next one, you're going to place their foot above the patella. Just rock, and you're just going to hold the foot there and just kind of rock there. But again, make sure it's above the patella. The next one, you're just going to rest it right on your hip. It's going to squeeze. But again, if you want more, you can kind of rock. And the nice thing about this treatment is you can perform many different techniques in a short amount of time, but then once you find a more tender area, then you can concentrate and slow it down a little bit in those areas then. And every now and then you can rotate the hip or the arm or the shoulder area and see if there's any kind of holding patterns at all. So you know what areas to concentrate on. Okay, next option, I'm going to place my hand right underneath the gluteal region. And just compress and stretch. So again, it's a little bit quicker kind of techniques than you're probably used to. But if the client gets really bored with the same thing over and over again, this is stuff you can mix it up. Okay, the next one, you can even bring it here and just kind of rock down. And if you want a little bit more, you can kind of compress the calcaneus and stretch out the gastrocnemius and soleus region. Or you can kind of rock it in and kind of squeeze. So again, it's not just like a regular stretch, you're adding compression during it too. Or you can kind of bend it. So before, some of the techniques that was over in this area, but you can position yourself. It's all about you too sometimes, so make sure you feel comfortable. The next one, I'm going to compress, bring it up and squeeze, bring it up and squeeze, bring it up and squeeze again. And if you're a type of therapist that needs to keep moving around all the time, this is probably the best options for you. Or you can bring it out, but just make sure everything's straight again. You kind of push into the quad. Or you can kind of bring it down. But again, keeping the legs straight as possible. Okay, next one. I'm going to hold like this, cup the calcaneus. And if you need a little bit more pressure, it looks a little awkward, but you can use more of your chin. And you can just kind of hold down the other leg if you need to. Compress that other side if you want. And this can be rotated out in different areas too if you want. Again, you can totally bring it out. And again, you can either push down and compress or kind of squeeze a little bit. So it all depends on what kind of pressure they can handle. But with the techniques, try not to hyperextend your wrist. Try to have it straight as possible or a little bit bent. And try to make sure your hand is more of a relaxed state during the techniques. You can even kind of just see how relaxed they are. If they're not really that relaxed, they're not going to shimmy as much, so their body isn't going to shake as much. Okay, now for full body techniques, what we're going to do is we're going to bring the leg over here like this, and you can even compress right on the pec area. But if a female has larger breast tissue, it's going to be harder to get that area. So it seems awkward, but you can tell them, is it okay if you kind of pull that area down a little bit so you can compress right at the pec area. Or you can just bring it up totally like this and just kind of compress the biceps femoris there, the hamstring muscle. and you can kind of rock. But you see, if I just compress this side, you see the arm will come up then. So that's why you got to kind of compress that area, or you can tell them to kind of hold on to the table. That's another option for some of these techniques then. So with this, I'm going to even squeeze the abdominal region, but not squeeze that I'm pinching, just compression kind of squeeze. And you can get right in the TFL area, really nice. And if you want, you can kind of circle a rotation with the compression too. But again, if I'm just going to hold that area, it's going to be painful for the average person. Some people might like that, but this is just a different way to treat those type of people that cannot handle a lot of pain. Next one, bring the arm over here and ask permission to cup the hip area. You're kind of pushing into the iliacus. And if you want another option, you can have them hold on to your shoulder right here. Compress, push, and pull. Compress, push, and pull. And you can work your way up the abdominal region at the same time. Or if you want to mix it up a little bit, like this, you can kind of rock it back and forth. Okay, next option, you can just bring the leg off the table a little bit, compress the pecs, and you're going to rotate the leg out. Or again, you can use your leg and kind of hook their foot, and you can compress areas too at the same time. You can even have the arm up here, rotate out, and compress more of the pec area. But this area is a really important area for low back pain, the psoas major and the iliacus. You can even rotate the leg out like this too then, okay? And one thing you got to be aware of is knobs on the table. So if there's a knob there, you can even have like a towel to drape over that area so it's not as painful for them if you're going to bring the leg off like that. Next one, you bring it like this, compress, and if you need to, you can even bring the arm like this. And you can even have them hold on to your wrist. So press and pull, so you get many areas all at once then. But if you're holding on, make sure they're holding onto your wrist too. So you're less likely to hurt their wrist. For the arm area, you're going to concentrate a lot in the pec area. So compress, push, rotate, compress, push, rotate. So it's not like a true massage again. So a true massage, you would be kind of gliding, but with this you're going to compress and rotate. And you can even rotate the arm around a little bit too. Another option, compress, push, externally rotate like this. Or you can go the opposite way and internally rotate like this. If you want, you can kind of have a nice fluid flow with it. Another option, I'm going to compress, push, and hold up. Press, push, hold up. And another option, when I'm going to compress and push, hold up, I'm going to rotate it too. Compress, push, rotate it. If there are person's arms are a little bit bigger, what you can do is compress, push, and just tell them, just a few times, kind of mimic this like this, and just tell them eventually, okay, push up, rotate, kind of punch the ceiling, there you go. And you can kind of have your hand there to kind of guide them a little bit, but have them do a little bit of the work. And they're going to let you know if it's ever too much pressure that way. That's what's nice about it. Okay, next one, we're going to get at the tricep area. So it doesn't look like I'm doing too much, but I'm stretching out the tricep right now. Compress, push. Or again, you can kind of rotate, compress, kind of like a snake bite. But it's not like the snake bites when you're in elementary school where they kind of hold it, add a lot of pressure, but this is just like a quick snake bite. Or you can, again, rotate it the other way too. If you want, you can kind of shake them off a little bit. Okay, next one, I'm going to rotate out and just kind of lift up the arm, but kind of squeezing the arm when I lift it up. And you can either stay in one area, okay, lift up, squeeze, drop it, let go. Okay, so just use that kind of method. So you're not squeezing tight the whole time. So it gives them a little bit of time to relax. Okay, next one. Rotate, pull, but I'm kind of pushing this down a little bit and then pulling back at the same time. Okay, or you can have it like this, compress, push, lift, compress, push, lift. If somebody has big history with dislocation, try to go slow at this technique first. And you're kind of massaging yourself at the same time, but you're not going to tell the client that, of course. Okay, both arms at the same time. You can kind of squeeze, rotate out, squeeze, rotate out. But again, different areas. And this treatment is a little bit more physical too, so it's going to feel like you had a workout afterwards. That's what's nice about it. If you want, you can kind of just rock them back and forth. But if you want even more stretch, have them hold onto your wrist. So you can kind of rock it back and forth like this. Okay, next option, I'm going to put my knee up on here and kind of stretch out that area and kind of compress at the same time. So use your knees and your thighs a little bit as an extra hand. It helps out. So it's not just both your hands that you're using all the time then. Or this, rotate it out, just kind of compress. So you can just compress up and down the arm. And with the regular part of the arm too, you can just kind of compress and push down. Or you can kind of rotate it in and compress, just like we did before with the leg. Or you can rotate them out the other way, of course. Or opposite. You can just go in different directions then with that. So again, it's like a compression continuously throughout the body. And even though it's right on the median nerve, you're just going to have more of an open hand as much as possible at this. Okay, with the hand and the wrist, you can kind of squeeze, or the opposite way too. Or you can pinky, but rotate it and compress the palm. But kind of make a dance out of it. Okay? Or you can kind of pull the finger and twist it and rotate it. Might hear a pop every now and then. Or you can compress the back of the wrist and lift up the wrist. And just kind of walk your thumbs around. Or you can go the other side, but try not to put any pressure right on the median nerve here. So it's just lateral and medial to that. And the palm again, you can even kind of spread it out too while you're performing it. So again, continuous motion. Some therapists can just perform a little bit of this every now and then, kind of mix it up in your regular massage, or make a full body out of it too. Or you can even kind of compress and pray for pain. We're just going to lift up the arm a little bit. Push your arm and your hand right in like the rhomboid region. And use the body as kind of a ratchet. You can even kind of rotate it too to mix it up. And another option, you can kind of push into the traps, kind of lift up the arm. But if you ever think, again, you're pushing too much pressure on the carpal region, just have them hold on to your wrist and just kind of push and pull at the same time. Just going to work up the neck area. And then when we get to the neck area, what you can do is hook your fingers right underneath the suboccipital ridge, hook, pull, hook, pull, hook, pull. Or you can hook and rotate it, hook, rotate it, hook, rotate it. So you're adding the pressure there, of course. Another option, put your thumbs right underneath the suboccipital ridge, lift up, compress, push, lift up, compress, push, lift up, compress, push. Or you can place your hand right there, you got to rotate the head and just move your thumb on this hand around in different areas while you're compressing and pushing. Another option, you can rotate the head, kind of push and rotate, kind of hook at the same time. You can use your knuckles in this area. Try not to put a lot of pressure right on the anterior portion. It's more like on the posterior portion here. So levator scapular region. The scalene's right here. You can kind of rotate back and forth like circular friction. But again, give a little bit of stretch with it so they can feel that. But again, the average therapist, what they're going to do is just rotate it and just kind of massage like this. But again, just get a little motion into it. And you can even use your forearm a little bit in this area. And this treatment, you don't need any oil. So you're not going to get oil in their face at all or nowhere else. So that's what's nice about this too. And here, I'm not even using a sheet. So you can even use it that way, or some people will use a sheet on there, but you don't need a flat sheet or anything else. So next option, you place your hand like this, rotate, stretch, rotate, stretch. But when you stretch, you can kind of rotate your forearm so you're hooking right underneath the suboccipital ridge, right underneath the suboccipitals. But again, whenever you perform on one side, try to make sure you perform on the other side too. And you can even kind of lift it up and down, or again, just rotate it too. You just hold the head down, kind of rotate and kind of hook. Okay, next option, what you're going to do is you're going to have them sit up a little bit. Right there, okay, lean back. Okay. Just going to walk up the body this way. If you want them to have, if they're not getting enough pressure, just have them lift their arms over their head and arch their back a little bit. The other way. There you go. So you can feel a little bit more pressure that way. But again, I got my elbows planted into the table, and you can even go up the neck area to compress all these areas too then. Okay. For the lower body portion here, we don't even have her head in a headrest. So you can have her head in a headrest if you want, but for some of the stretches, it's better to have it out of it. What you can do is have them every now and then, like every 5 or 10 minutes, have them switch their head to the other side, so it makes them feel more comfortable, so they're not going to tense up in one area then. For the feet, we're going to start at, what we're going to do is rotate like this. So it doesn't look like a stretch, but it is stretching right at the arch. And you can even use more of your palms too, kind of rocking the body. We'll get it to the calf. You can rotate it out, so you're getting a little bit of a stretch with it. Or again, you can just push down, but if they want a little bit more, just rotate it. For the lateral side, you can kind of push in, or you can kind of snake bite it too. So one hand goes one direction, the other one goes the other. Next one, we're going to lift it up, push in and pull. Push in, pull towards you. Push in, pull towards. Push in, pull towards. But if you want, you can use your knuckle there too. Or you can kind of hook it this way, and we're going to bring it towards me. Push this way. Pull and push. Pull, push. Pull, push. So you can, with your fingertips or your knuckles for that area. Or you can compress, rotate around. Compress, rotate around. Compress, rotate around. Right on the hamstrings. Or you can go the other way too. Another option, elbow in the glute, lift up. Elbow in the glute, lift up. Elbow in the glute, lift up. Or rotate, push. So I'm going to pull it towards me and push away. Or the opposite way. Or you can just compress in one area and rotate it. Rotate it the other way. Another option, you can put your knee on the table like this and rotate and push out. And pushing right into the gluteus medius, right in the sacrum region, but not on it, of course. And you can have the leg straight too and rotate it out. Great for sciatic problems, piriformis syndrome, even a little bit of low back, because we're getting into the gluteus medius here. Next option, you can kind of compress and squeeze. And you can either have your knee underneath here still, or you can put it back on the table. So whatever feels more comfortable for you. So again, use your body parts as extra hands. Next option, you can stretch out the quads this way, and make sure you're not putting a lot of pressure right on the tibia bone, but you're going to compress the tibialis anterior, and you can rotate the foot too. So you can either go plantar flexion dorsiflexion thing, or you can kind of rotate it around and compress and squeeze around that. Okay, next option, we're going to go here, 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 and here. So we're going to use this as a ratchet, push this down like this, back and forth, and lift it this way. But again, the elbow and the forearm on this side, that's doing the movement. Okay, next option, bring it here, rotate it out, and you can kind of compress the TFL region, the biceps femoris, even into the gluteal region. But again, be aware of the knobs on the table because their adductors are kind of close to that region, so you're not pushing their leg into that area. And you can even kind of squeeze. But just keep that movement going. Next option, here, here, flex it up. And then you can kind of compress the gluteal region at the same time. And again, pull. Okay, for the lower back area, you're going to push into the quadratus lumborum, but not on the lumbar, of course. Push in, pull back. Push in, pull back. Just like we performed on the gluteal region, but now you can perform it on the lower back area. Or you can kind of pull and push at the same time. Pull and push. Okay, next option, just ask permission to cup their hip. So you're going to go here and cup their hip. You're going to lift up. So this is a great low back stretch, but if you need to, you can put your knee on the table. You kind of work your way up and down the hip. Okay, next one. Just kind of squeeze, or even for the gluteal region. This is really good for menses. Okay, next one, you're going to kind of rotate in and push, and do a little stretch. Or you can do it the opposite way too. Okay, now to the back area. We're going to come push and compress. Now with the arm, you have it here. Compress, push, and cross your hands. But you're stretching out the pec area, plus you're getting the lower back area too. Another option, you can place their hand right on their head. Compress, push up, compress, push up. So right in the rhomboid area. Okay, next option, you can rotate, pull, and stretch. Or you can have them hold on to your wrist and push and pull at the same time. And you can rotate the wrist in different angles too while you're performing it. And then be careful when you bring it back, rotate it down like this, and we're going to perform it this way then. So have them hold on to your wrist again, compress right in the rotator cuff region. Okay, next option, just have them turn their head the other way. And you can place your leg like this. You can rotate and pull up. Second time then. Okay, next one, you can just have the arm on the table like this. So, just going to rotate and push in. Or you can rotate it out too. Okay, for the shoulder area, it's going to compress, or you can use your knuckles if you want. If you want, you can kind of roll it, or roll it opposite. Or you can kind of twist it too. So anywhere in the back, you can kind of twist, push down, and twist. Push down and twist. And you can even use your forearm. So it's compression, stretching a little bit. Or if you want a little bit more stretch, lift up the arm, use the forearm. With the head area, rotate like this, cross your hands. But in reality, always make sure you even out the other side. Next option, you can kind of cross your hands and compress. It's better to push than to pull, so you can get more pressure that way. And you can also push your hand right into the iliac crest and just kind of stretch around. So it's kind of getting the fascia in the way too, but it's not a true fascia stretch. But it's the same concept. Or you can do like snake bite anywhere in the back. You can even use your forearm or elbow, kind of rotate it. Try not to put a lot of pressure right on the vertebral border of the scapula here. Make sure you don't put any pressure on the vertebrae, of course. You can even rotate it back and forth with your forearms if you need a little bit of break. Or you can just kind of push down and pull. Push, pull. So stretching out the erectors. Or you can just push and push too. And you can kind of push into the hip and pull the upper body in different directions, or opposite. And to kind of slow it down, just slow compressions. You can just go throughout the whole body then. Come back up if you need to. And kind of warm them up a little bit. So after a treatment, they're a little bit cool usually. Okay, so thank you for watching this video. Hope you got a lot out of it. And if in doubt, you can incorporate these kind of techniques into your current treatment, or you can make a specialized treatment with these kind of techniques too. But every now and then you might have a client coming in that just wants a massage with their clothes on. So it's kind of like table massage, kind of like chair massage with your clothes on then. So just giving you different options, and hope you got a lot out of it. Thank you.